Hi again, folks. I need to talk about the coronavirus again. I've been following this thing very diligently, um, and it's really starting to worry me. Well, I should say it started to worry me weeks ago because of where it started and the lies that we were hearing. I was watching videos from China. I was watching um, conflicting reports, throughout the world about what was going on, and China's refusal to admit to anything or release anything. And then over a period of weeks to a month. I mean, it's only been a month. What was it? This was recognized in December. That's when the outbreak started in Wuhan, the end of December. So, we've got, it's 2 months basically of data so far. And each country seems to be taking its own or using its own methods for quarantining, for fighting this, whatever they're doing. I don't know if any of them are going to be very successful. I think, I know China hasn't had a great reputation, but their method of quarantining lately has, I think, slowed the virus down, which is super because that allows, the medical facilities and testing to be increased over a period of times and lessen the number of people that are false positives. Because what China was doing was anyone who had a fever or were showing signs of any kind of respiratory or flu-like symptoms, they were quarantining them. They were actually putting them in with other people who were most probably sick at that time, and they were infecting them even if they didn't really have the coronavirus. So that method really, it worked, but it was a brutal method. And I think if they had access to testing, real testing, genetic testing of the virus, as we hopefully will within the next few weeks, as Vice President Pence just said today, uh, we'll be much better off. But in the interim, what's happening here is people are just generally ignorant about this. They're believing politicians. Politicians aren't going to tell you the truth. They're going to want to win, and they win by numbers, and they will give you false numbers. President Trump already, whether it's because of his mental state or because God knows with him, God knows, God help him, if there is a God. He's already, contradicted scientists. He's seen as a role model for a lot of Americans, unfortunately. Um, so there's a great need for a reality check here. I have been forced. I forced myself to be quarantined. I work from home, as I mentioned yesterday in my video, and my office's policy is that it's work as usual. Come to the office, spread the disease. My response is, do I want to walk into a room of, I don't know, 100 people and be one of the lucky 5 who dies from this virus? Are you going to pay for that? Are you going to pay for my care? Are you going to take care of my family for the rest of my life or for the rest of their lives? No. So um, they can say what they want. People can say what they want. Fine. I don't care. I honestly, I think what's happening now is we're just going to have a lot of people spreading this because of ignorance. And what what I want to avoid is my exposure to ignorance. So I was thinking of going out tonight. It's ladies' night. At my favorite bar here, and I love going there. I see my friends. It's a lot of fun, but I don't want to. I'm really scared. Um, the death rate in Washington State, I believe we just had another death just before I'm recording this. The There were 27. I'm sorry. right? 27 cases, and now there's an additional death, brings the death toll to 10. And they're blaming it on the fact that these people were sequestered on the cruise ship, and most of them were brought back there, and they weren't quarantined sufficiently, they weren't diagnosed sufficiently. So, what does that tell you about the ability of the virus to spread and its actual death rate? This is what scares the crap out of me. 3 people have now been diagnosed in Miami. There was, again, I mentioned someone yesterday passed through the Miami airport, which is local to basically everything here in Miami. So, the workers, the people traveling through, uh, you know, it's mind-boggling. So you know, I want this. I want people to understand the reality, the gravity of this, and I don't know how else to communicate this. Even my friends, they're like, "Really? You're going to stay home? You're not going to go out? You're afraid to go out?" And I'm like, "Yeah, of course I am, because you don't know who has it, and they are contagious. Even if a person has a high enough viral load, and they blow their nose or sneeze or cough or talk to you, you're gonna get it. It's inevitable. So, with that said, look at the stats. There are any number of websites. I'm avoiding the CDC and the WHO websites because they're reporting the numbers, but they're still saying, don't wear masks. Don't just wash your hands. Don't worry about it. It's not going to be as bad as people are saying. The reason you wear masks is to not spread it because you don't know you have it. And they're telling people not to wear masks. And the reason for that is because there's not enough. There's not enough for the medical people. And I understand that. I do. I really do. And God bless them. Doctors and nurses and everyone working in the hospitals, I can't imagine. They have some of the hardest jobs ever, especially with this. And I wish them, all the health in the world. But again, telling people that they shouldn't wear masks, it does prevent the spread. It doesn't. Okay, depends on the type of mask, of course. There are all sorts of types. The biggest problem is most people don't know how to use them. And if you don't know how to use them, you're still breathing the air. Okay? It is not filtering the air completely, but it is filtering slightly. So it does lower your chance. Okay? If somebody sneezes next to you, the particulates in the air are immense. It's astronomical. Okay? But if you're outside and somebody sneezes, 10 feet away from you, that mask may just help you. And this is what they're not telling people. So, if you already have them, great. Use them. Use them, because if you have it, I don't want to get it. And if you have them, use them to hopefully prevent a little bit. Just to help you prevent getting it just a tiny fraction of a bit. No matter what the CDC or WHO says or a doctor say, okay? This is a very, very critical moment. This is when we have the ability to contain this. We have the ability, but they're not going to allow us to do it. My company is telling me to come to the office. Although I have 100% ability to work from home, 100%. There's no reason why I have to go in the office other than it's company policy. I'm sorry, is company policy going to pay my spouse when I'm dead? No, they're not. So, with that said, that's enough for me for the moment. I'm going to look for updates. I'm going to try to make a new video with some new numbers, some actual numbers. I'm scouring the internet at this point for state by state numbers, deaths, also countries. There's a lot of misreporting going on, especially from Iran and South Korea and all of these other. And there's countries that have it and they're not reporting it, which is also very scary, because flights to and from those countries aren't even being looked at. So think about that. So anyway, I'll be back. Hopefully, I'll be able to do my cryptocurrency videos soon. And everybody be safe. Again, as one of my heroes say, he always says, eyes open, no fear. Be safe. Ciao.